Welcome to our presentation on heart disease, high blood pressure, and stroke. After participating in this presentation, you should be able to explain what to do if you notice symptoms of heart attack or stroke, what causes vascular disease, what do heart disease, high blood pressure, and stroke have in common, and how to promote vascular health. In the United States, the most common type of heart disease is coronary artery disease. This can lead to a heart attack. Coronary means heart, and artery is blood vessels that bring blood from the heart to the body. So coronary arteries are the vessels that bring oxygenated blood from the heart back to the heart muscle itself. You can greatly reduce your risk for heart disease through lifestyle changes and, in some cases, medication. An acronym to be aware of in regard to heart attacks is ACT NOW. A is arm, discomfort in your arm or shoulder. C, chest, pressure in your chest. Throat, pain in your throat, teeth, or jaw. Nausea or indigestion. Feeling shortness of breath. That can be an indicator your tissues are not getting enough oxygen. And feeling weak or fatigued. Heart failure is a different chronic disease. It is not a heart attack, but it is a serious disease of the heart. Heart failure develops over time as the heart becomes weaker and less able to pump blood efficiently. Heart failure is usually caused by high blood pressure and/or narrowing of your arteries. Heart failure is sometimes called congestive heart failure. Notify your provider if you've gained 3 pounds in a day or 5 pounds in a week. This can be an indicator of fluid retention. Also notify your provider if you have increased swelling in your feet and ankles, or if you feel short of breath. In heart failure, the inefficient pumping can lead to fluid backing up surrounding the lungs, making it difficult to breathe. Cause of heart attack and stroke includes blood clots or thrombosis. These are caused by bad heart rhythms such as atrial fibrillation, which is when the heart is pumping quickly but no blood is being pumped out. Having a bad pump, having a history of heart attacks, using alcohol and drugs, chronic inactivity, having a hole in the heart, which is often present at birth, or other problems such as cancer, infections, injury, autoimmune diseases, and genetics. If you have an area that is hot, red, painful, or you have sudden shortness of breath, this is considered an emergency, and you should call 911. A sudden onset of a terrible headache, changes in speech, vision, or control of your facial expressions or arms and legs are also considered emergencies, and you should call 911. Deep vein thrombosis or clots in the legs often result in a painful, reddened, hot area, typically behind the knee or the calf. You may also experience similar symptoms in the arm, and that may be an indicator of a clot or deep vein thrombosis. Sometimes these clots occur in the brain. Here is an example of a cerebral venous sinus thrombosis. And sometimes they occur in the lungs, and that is called a pulmonary embolism. Causes of strokes can be leaking vessels, which may be caused by smoking, alcohol consumption, high blood pressure, cocaine, methamphetamines, or genetics. Again, if you experience the sudden onset of a terrible headache, changes in speech, vision, or control of facial expressions or arms and legs, that is an emergency, and you should call 911. Here is an acronym to help you to remember when someone may be experiencing a stroke. Be fast. So be fast and call 911. Any of these sudden signs could possibly mean the person is suffering a stroke. So B for balance. Watch for sudden loss of balance. E, eyes. Check for vision loss. Face. Look for an uneven smile or expression. Check and see if one arm is suddenly weaker than the other. Is the person having slurred speech or speech that doesn't seem to make sense, saying words that seem like silliness? Time is very important. Be sure to call 911 right away. Even if these symptoms are experienced and then go away, still call 911 for an assessment. What do heart disease, high blood pressure, and stroke have in common? Poor blood vessel health. Blood vessels are your vascular system. Things such as coronary artery disease, which is when plaque builds up within the arteries that bring oxygen to the heart muscle. Cerebral vascular disease, reduced blood flow to the brain due to vessel narrowing, clot formation, blockage, or blood vessel ruptures. Arteriosclerosis. Blood vessels carrying oxygen away from the heart become damaged from factors such as high cholesterol, high blood pressure, diabetes, and certain genetic influences. What can cause poor vascular health? High blood pressure, diabetes, high cholesterol, tobacco and nicotine use, eating processed foods, sleep apnea, obesity, inactivity, genetics, and air pollution. You'll notice that many of these can be improved or controlled through lifestyle change. Blood pressure is a measurement of the pressure within your vessels. High blood pressure or hypertension increases the risk of heart attack, stroke, and other serious health problems. Normal blood pressure is less than 120/80. Blood pressure higher than 180/120 is considered an emergency, and you should call 911. If you have diabetes, your sugar levels over time may damage blood vessels, causing them to no longer be able to deliver oxygen and nutrients to the nerves, muscles, and organs. An A1C, which is a lab test for diabetes, over 7 means that you are at risk of damaging your blood vessels. High cholesterol means you have high levels of fat in your blood. This can lead to plaque within your blood vessels, causing a narrowing of the inside of the vessel. This can result in low or lack of blood flow to your heart, brain, lungs, muscles, and organs. The HDL is good cholesterol. It carries other cholesterols back to the liver. LDL is considered quote-unquote the bad cholesterol and leads to plaque. And high triglycerides come from the fats that we eat. Smoking or vaping and air pollution can cause a narrowing and irritation of the inside of the blood vessels. This can result in low or lack of blood flow to your heart, brain, lungs, muscles, and organs. They can also cause irritation and constriction of the blood vessels. Air pollution is not usually a problem in the Snoqualmie Valley, but it is a problem on smoky days, and you should avoid going outside on those days. Eating processed foods can cause inflammation within the blood vessels, reducing blood flow to the brain, heart, and organs. Sleep apnea, or stopping breathing while sleeping, increases the risk of coronary vascular disease. Sleep apnea has been linked to higher rates of blood pressure, stroke, and coronary artery disease. Sleep apnea causes your breathing to stop and restart and can make it hard for your body to get enough oxygen. Do you snore? Do you wake frequently in the night? Are you still tired when you wake up in the morning? Do you wake up with a headache? Do you frequently need to take a nap during the day? If you answer yes to these questions, please talk with your provider about the possibility of sleep apnea. Studies show that a BMI, which is weight for height, is a BMI over 25 is strongly associated with higher risk of coronary vascular disease and stroke. Studies show the traditional BMI chart is not accurate for all ages, genders, and races, but unless you are near the borderline between healthy and obese, it is a good general reference. Talk with your provider if you are unsure if you should lose weight. Here's an example of a BMI chart. You can find other charts by Googling BMI chart. To use this chart, find your weight at the top and then move down to your height on the left-hand side. The chart is color-coded for healthy, overweight, obese, and severely obese zones. If you are overweight or higher, talk with your provider about losing weight. Genetics also play a role in high blood pressure, stroke, and other related conditions. Several genetic disorders can cause a stroke, including sickle cell disease. People with a family history of stroke are also likely to share common environments and other potential factors that increase their risk, called social drivers of health. Age, as you increase your age, your risk of heart disease also increases. The chance of having a stroke doubles every 10 years after the age of 55. However, 1 in 7 strokes occur in teenagers and young adults, ages 15 to 49. Heart disease is the #1 killer of both men and women. Stroke is more common in women than men, and women of all ages are more likely than men to die from stroke. People who are non-Hispanic, Black, or Pacific Islander may be more likely to die from a stroke than non-Hispanic, white, Hispanics, American Indian, or Alaskan Natives and Asians. Heart disease is the leading cause of death for people of most racial and ethnic groups in the United States. Lifestyle changes that you might consider. Quit smoking. Think of your 20-year-old weight and try to reach that goal within 5 years. If you want to lose 100 pounds and you decide to do that in 5 years, that equates to about 1.5 pounds a month. Increase your physical activity. Park far away. take the stairs. Walk for 20 minutes after eating your meals. Aim for at least 150 minutes of moving your body each week. Don't eat in the evening when you're done with physical movement. Eat whole foods. All food should go bad and not contain preservatives. Think about shopping the outer edge of the grocery store where the whole foods are kept, and not the inner part of the store where the foods with high in preservatives are. 80% of your calories should be from fresh fruits and vegetables. Plan your meals ahead of time. Limit your meat consumption. Eat most of your proteins from the ocean, the air, and the least of your proteins from land. Drink plenty of water and take your medication as prescribed. Remember, about 80% of the foods on our supermarket shelves didn't even exist 100 years ago. These are processed foods. Eat real food. What do heart disease, high blood pressure, and stroke have in common? Hypertension, diabetes, hyperlipidemia or high cholesterol, tobacco and nicotine use, eating processed foods, sleep apnea, obesity, inactivity, genetics, and air pollution. What do we have in common? We can prevent or improve all of these with lifestyle changes. Here are some resources to help you learn more.